Dear colleagues and professors, my talk will be on foot anatomy and biomechanics overview. The foot is an engineering marvel. It is a complex structure composed of bones, 26, muscle joints, 33, fascia, ligaments, gliding tendons, and muscles. All work together to perform the diverse function of the foot. First, the foot must be resilient to act as a shock absorber of the ground reaction force. Second, the foot must be rigid to act as a lever to propel the body across the ground. Imagine an individual whose foot is in contact with the ground and it is not resilient. What will happen? Severe discomfort will be experienced by the individual because of the ground reaction force. Again, examine an individual who is just about to leave the ground and his foot is not rigid. What will happen? He will stumble and fall down immediately. In order to study the functional anatomy of the foot, one must study the mysterious bone of the foot, which is the talus. The talus is an intercalated segment without muscular attachment. So how can it move? It can move only by the movement of the intercalating bones, namely the tibia, the fibula, and the calcaneus. The whole foot moves a complex movement around the functional entities of the talar joints. These movements are complex, not simple, in the three cardinal planes, namely the sagittal plane, the coronal plane, and the transverse plane. The sagittal, the coronal, and the transverse plane around the talar articulations. What are these talar articulations? By no means three, which are called triple joint articulations. Namely, first, the talocalcaneal articulation, which is the subtalar joint, and the two transverse tarsal joints, namely the talonavicular joint, which is also called acetabulum pedis, because it simulates much the hip joint with the talar head as the femoral head, and the concave articular surface of the navicular at the acetabulum, and the calcaneocuboid joint. These three joints or triple joint articulations have a common fulcrum or axis, which is the strong interosseous talocalcaneal joint. During walking, that's to say during the gait cycle, the leg rotates. Why? Let me remind you by the proximal joint, which is the knee joint. During knee extension, the knee is locked by external rotation of the tibia on the femur. So, with knee extension, the leg rotates externally. And during knee flexion, the knee must be unlocked by flexion of the knee by the popliteus muscle and medial rotation of the tibia on the femur. So the leg rotates medially in knee flexion. So imagine an individual whose subtalar joint does not rotate with rotation of the leg. What will happen? The individual will stumble immediately. This rotation is in order to adapt for the ground reaction forces and the inclined surfaces of the ground. The talocalcaneal or subtalar joint is composed of three articular surfaces: anterior, middle, and posterior facets. Anatomically, the anterior and middle facets are separated from the posterior facet by the sinus tarsi, and both have independent synovial cavities. But biomechanically, these three articular facets work together as one joint with common functional axis of motion, with no independent motion. Imagine the room door. The room door had 3 hinges lying on the same line, but all perform one function, which is opening and closure of the door. The posterior subtalar joint is the most crucial joint of the triple joint articulation. It is between the posterior articular facets of the talus and calcaneus, the conical facets of the talus and the calcaneus, with the talus concave and the calcaneus convex. The axis of the subtalar joint is oblique. It's not a straight one. It is not in a straight plate, to allow shift, glide, and rotational movements around the interosseous ligament. It extends from the posterior superior lateral aspect of the calcaneus posteriorly to the center of the talar head anteriorly, with considerable anatomic variation, to allow shifting, gliding, and rotational movements. It deviates from the sagittal plane. Look, the sagittal plane is the plane passing by the second metatarsal bone. It deviates by 23 degrees, but this is an average, and the range is very wide. And it also deviates from the transverse plane by 41 degrees. Again, it is a range, and it is an average, and the range is very wide. The black line is the axis of the subtalar joint. So it deviates from the transverse plane by a range of 21 to 69 degrees with an average of 41 degrees. And also it deviates from the dotted line, which is the sagittal plane, by a range of 4 degrees to 47 degrees with an average of 23 degrees. Let's now analyze these complex motions: shifting, gliding, and rotation. Inversion. Inversion is not simply bringing the calcaneus to the middle line of the body, that's to say bringing it medially. It's not that simple. Look to the blue shade. Inversion is accompanied also by elevation of the medial border of the foot or supination, and with adduction of the forefoot. It's also accompanied with ankle dorsiflexion. Its range is up to 30 degrees. On the contrary, eversion is not simply bringing the calcaneus away from the middle line of the body, that's to say laterally. Look to the red shade. It is also accompanied by elevation of the lateral border of the foot or pronation, and with abduction of the forefoot and ankle dorsiflexion. Its range is up to 10 degrees. What governs these shifting, gliding, and rotatory movements? The contributing factors include the body weight force transmission, the muscle balance, and the bony conformation. The body weight is transmitted from the tibia and fibula to the talus, and then to the calcaneus, and then 2/3 to the navicular and 1/3 to the cuboid bone. There are 3 groups of muscles acting across the ankle and the triple joint articulations. The inverted groups include tibialis posterior, flexor digitorum longus, flexor hallucis longus, and extensor hallucis longus. The inverted groups include peroneus longus and brevis, and extensor digitorum longus. And the neutral group without inversion, these are the tibialis anterior and the triceps shuri. Rotation of the leg, as we mentioned, external rotation with knee extension and internal rotation with knee flexion. This rotation is coupled to the ankle and subtalar joint. So the ankle and subtalar joint can be considered as one universal joint. During internal rotation of the tibia rotates externally, so the tibia rotates internally, so the talus will rotate internally, and there will be eversion of the subtalar joint or valgus position. And this causes unlocking of the transverse tarsal joints, allowing flexibility through the midfoot. Why unlocking of the transverse tarsal joint? Because their axis at this position will be parallel to each other, and this allows flexibility through the transverse tarsal joints. On the contrary, external rotation of the leg during knee extension is accompanied by inversion of the subtalar joint or varus position, with locking of the transverse tarsal articulations, creating a rigid midfoot for toe-off stance of the gait. Why locking? Because in this position, their axes have lost their parallelism, and this accounts for the rigid construct of the transverse tarsal joints during the terminal stance phase of the gait. This is a drawing of the various phases of the gait cycle. The swing phase is followed by the stance phase, which is further fragmented into 5 subphases. First is the heel contact or heel strike, and then the foot flat or early flat foot, and then the complete foot flat or the mid stance or late flat foot, and the heel rising and tiptoe gait. The table summarizes the phases and the state of the leg, the ankle joint, the subtalar joint, and the transverse tarsal joints during different phases of the gait cycle. The blue shade is the swing phase. So in the swing phase, the leg is internally rotated, as we mentioned. So the subtalar joint will be pronated, the transverse tarsal joint will be unlocked and are freely mobile, okay, and the ankle is in dorsiflexion. Now we'll come to the stance phase, which begins with the heel strike. The heel strike is the leg is just coming from the swing phase, so it's still in internal rotation. So the subtalar joint is pronated and the transverse tarsal joint are freely mobile, with the ankle joint neutral or in plantar flexion. How neutral or plantar flexion? By the plantar flexors? No. By the gravity alone? No. By the gravity resisted by the extensor group of muscles. And then comes the foot flat and the mid stance phase, with the foot is in the typical stance phase, the leg is externally rotated, the subtalar joint is supinated, the transverse tarsal joint are rigid, and the ankle is in dorsiflexion in the foot flat and mid stance phase, but becomes plantar flexed at the heel rise and toe off phase. The take home message: the subtalar joint is an integral component in lower extremity function. In pes plano valgus, although it is a single plane deformity, but yet the deformity is more complex than we think. It is in the 3 cardinal planes: sagittal, frontal, and transverse planes. Lack of motion at the ankle joint is accompanied by compensatory increase in the subtalar joint and transverse tarsal joint motion. We must consider also the coupling of the leg and subtalar joint. This is important to recognize clinically in cases of hindfoot deformity resulting from neuromuscular disorders. Thank you.